Hi, my name is Alexis Jurian, and I'm a student in the Psychiatric Mental Health Nurse Practitioner program at EKU. The topic that I've chosen to discuss is psychotherapy as treatment for adolescent depression. Depression is an issue currently affecting millions of adolescents, and symptoms include general depression, anhedonic loss of interest, and anhedonic lack of positive affect. The National Institute of Mental Health estimates that an estimated 3.1 million American adolescents suffered from depression in 2016. In adolescents aged 12 to 17 years old, depression affects about 12.8% of that population. Adolescent depression is addressed in the Healthy People 2020 campaign. In the Mental Health and Mental Disorders (MHMD) section of the campaign, Goal MHMD 4.1 is to reduce the proportion of adolescents aged 12 to 17 years who experience major depressive episodes. This goal has been identified as a leading health indicator, which is a goal that is selected to address an issue with a high priority. As psychiatric nurse practitioners work to treat depression, it is important to be knowledgeable in the latest appropriate treatments in order to have the best patient outcomes. In two different studies reviewed on the effect of psychotherapy as treatment in adolescent depression, the first study was by Postle, Martin, and Garber in 2013, and they conducted a randomized controlled trial to determine the effect of a cognitive behavioral program on depressive symptoms in 518 adolescents. These adolescents were part of a wellness class in their local high school in the mid-south of the United States. The adolescents were randomly assigned to the CB group, which was the intervention group, the nonspecific control group, the NSP group, or the no intervention control condition, which was the NIC group. The CB group received 10 90-minute weekly sessions. The sessions focused on understanding the relations among cognitions, emotions, and behaviors, and taught the students how to identify and challenge negative emotions, assertiveness, and social cognitive skills. There was also an introduction session and a review/celebratory session. The NSP group also received 10 90-minute weekly sessions, but they did not convey information about the CB model or teach specific cognitive or social skills in that group. And then the NIC group attended the school's wellness course as usual. Depressive symptoms were monitored using the Children's Depressive Inventory, also known as the CDI, which is a 26-item measure of cognitive, affect, and behavioral symptoms of depression. The CDI differentiates between normal and clinically depressed youth. At the 4-month follow-up, CDI scores in the CB condition were significantly lower than the NSP condition, P equals 0.47, and the NIC condition, P equals 0.003. The study demonstrated that an intervention based on CB is effective in reducing depressive symptoms in adolescents at 4 months that is not likely due to simply nonspecific factors. In the next study that was chosen by Wana Chayukul and colleagues was conducted as a randomized controlled trial to determine the effect of computerized cognitive behavioral therapy on depressive symptoms in 84 adolescents in detention. The intervention group received 6 weekly sessions lasting 45 to 60 minutes. The program was called Guided Self-Help CPT program with therapist support, and it was based on Beck's cognitive theory and the ADDIE model of instructional design by Seals and Glasgow. The program consisted of a conceptualization of depression, a method of self-observation, self-rating of negative automatic thoughts and negative emotions, modification of thinking, and problem solving. The control group received the usual treatment for depressed adolescents in detention. The sample was comprised of 84 adolescents, and it was recruited from one juvenile vocational training center in northern Thailand. Depressive symptoms in this study were monitored by the PHQ-9, created by Lotrical. Study findings by Wana Chayukul and colleagues revealed that the CBT significantly lowered depression in adolescents immediately after completing the program. P is less than 0.5. However, the mean depression scored at the 1 and 2 month follow-up were not statistically significant. The CCBT program was demonstrated to be effective in reducing depression in adolescents studied immediately following intervention. Similarities in the Postel and colleagues 2013 study and the Wana-Chayukul and colleagues study in 2017 included an adolescent population, psychotherapy used as an independent variable, a control group receiving no psychotherapy, and results showing that psychotherapy is indeed effective in decreasing adolescent depressive symptoms. Long-term follow-up should be completed to see how the effects from the interventions are sustained. The use of psychotherapy for treatment of adolescent depressive symptoms has shown to be effective in decreasing depressive symptoms. This intervention can be used in conjunction with or in lieu of antidepressant medications. The setting where this can be implemented is in an outpatient psychiatric office. It can be done with a psychiatric mental health nurse practitioner, or the patient can be referred to a therapist to get more in-depth psychotherapy. In conclusion, between the Postel and Wana-Chayukul studies, it has been shown that psychotherapy can help reduce depressive symptoms in adolescents, and it should be something that psychiatric mental health nurse practitioners think of and use when treating their patients.